Welcome, everyone. Our educational module today is Nutrition 101 for Healthcare Providers. Thank you, everyone, for joining me. And I am your educator today, Laura Kopec. I have been in business since 2007 as a health educator. I am a practicing functional practitioner and published author, podcast host, and I'm really looking forward to helping you understand nutrition from a different perspective and how you might incorporate it into your practice if you have an integrated model, or even if you don't, if you want to just have a different understanding about nutrition. All right, let's get started. Again, I am your educator, Laura Kopec. I have 2 master's degrees and several certifications. I have been in practice for more than 15 years, and I'm really passionate about the subjects that I teach. And so I hope you'll enjoy today's module. There are a lot of misconceptions around healthy eating. So I kind of wanted to start with this and really just start with getting past some of those early initial misconceptions, okay? The first is that food is actually information. It is a little bit of like biocode that becomes the epigenetic environment for our own personal biocode to function and replicate itself. So that's kind of a fancy way of talking about food, but really we think about food so unconsciously, so disjointed. The first misconception is that we think it doesn't have anything to do with health. But more than 60% of illness and disease has a nutritional component. And most people think they eat healthy enough, because there's really a lot of misunderstanding about what it is. And the first thing is that healthy eating costs too much. That's another misconception. But clean eating versus restaurant plus groceries, looking at the entire spectrum of where you eat food can really bring a new perspective, because when people just look at groceries and they don't think about eating out as part of their food budget, then they really can start to think, I don't want to shop at a healthy grocery store, or I don't want to shop healthy because it's too expensive. But if they start to look at what they're spending on the restaurant, they may rethink that. And organic is not the only way of eating healthy. I think that's another misconception around the cost of healthy eating. Oh, I can't afford organic, right? Or I want to be able to buy organic. But again, that's not really the only way to eat healthy. So we're going to talk about a lot of that. I don't like it. I don't like to eat healthy, or my kids don't like it. I hear this a lot. And really, the greatest gain is going to be in vegetables. Statistically, they've shown that if you just eat more vegetables, it has the greatest gains in terms of things that we don't do or different choices that we do. And if you consider healthy eating, or at least your veggies, a little bit like brushing your teeth, or when you're talking to kids, like doing your homework, there are things we don't like to do that have to do with being responsible for ourselves and our health. And so if you can frame it that way, because in this culture that we're living in, food is all about socialization. We eat at about every social event there is, and we've lost the connection between food being something we need to be responsible, another way of being responsible for our body. There are a lot of health conditions that actually benefit from better choices in nutrition. Skin issues. Just about every skin issue has a gut issue, and gut issues have a food component. They have a nutritional piece to the puzzle. So it is very interesting to me that a lot of specialties in skin don't really talk about nutrition. And it's really a missed opportunity to help people get accelerated results. Immune system, food allergies. Food allergies are actually part of the immune system. Autoimmune, food sensitivities is a lighter side of the immune system. Genomic markers, sometimes that is a risk assessment towards certain foods to just be aware of. And then illness. I think we don't even really talk about food when it comes to even acute illnesses. Mental health. I am such a big believer in this because I see incredible transformations when people can make a real commitment to their nutrition as a part of addressing mental health. And that includes things like anxiety, depression, ADD, ADHD, even brain fog sometimes is a big part of what they're eating or not eating. And then chronic issues like thyroid, fertility, chronic fatigue, even hormones. There are foods that are hormone disruptors, and we're eating them on an ongoing basis and not even think about the implication of managing our hormones or managing our thyroid by taking a greater effort in nutrition and in our diet. Okay, there's a bigger piece to this too, and that's, what's happened in food production. I mean, one of the things that's happened is we have these artificial ingredients. They bring the cost of manufacturing food down. So that might be greater profits to the manufacturer, but it is at the expense of an individual's health. Some of them are called excitotoxins, and they literally will excite chemicals and cells in the body, overstimulate them, excite them into the point where they might spin and even burst. And so this can have a real big effect, not only on the body, but on mood, can have effect on the brain, behavior. And so we really want to talk at least about some basic bad boys: high fructose corn syrup, aspartame, food dyes, MSG, and those artificial ingredients. We can get into a deeper level and talk about, the contamination of food. Things like mold, which are going to be found in coffee, cereal grains, or mercury in seafood like tuna, or lead in bottled juices. Even tap water may find its way into bottled water that will have its own toxins in it. And the reality is that, again, we're not thinking about food in terms of what the consequences might be, and that it could be dysregulating our immune system and having an impact on our health. And the reality is that anything that doesn't contain DNA or RNA is not really recognizable by the cell. It's not really recognized by our biocode. We are made up of DNA and RNA, and we need to eat things that contain DNA and RNA. It's a match. It's it's fitting those pieces of the puzzle together so that the body operates with food as fuel. Even if it's not apparent, if something affects the health right away, again, those foods that don't have those molecules in it can have a slow deterioration on a person's health. So real food, why real food? I mean, we are what we eat. It sounds clever, but it is true. Food is fuel for the body as a computer, and that needs to run. It needs to run on a certain fuel. It's the car's version of gasoline, and you can't put other things in the gas tank and expect the automobile to run efficiently. Epigenetics, that is a term that includes the environment we put the cell in. What is the environment the gene is having in order to function at an optimal level? So even variations to genetics called SNPs in the study and testing of genomics is affected by the food that we're eating. And if you are doing genomic testing in your practice, or if you've gotten genomic testing done as an individual, it's really important that the power in that risk assessment really is in the healthy environment that the cell is in, not even necessarily eliminating a particular food that a person may or may not have risk for, but really understanding that the total environment that the cell is in is going to function better with real food. It's really important to know food, to know the difference between processed and packaged and real food. The difference between a potato chip that might be potatoes, oil, and salt versus a potato chip that might also have flavorings on it that include food dyes and food colors and different kinds of sugars, or versus the actual potato itself. So again, studies show that eating vegetables and giving up those drinks, anything that